As you may or may not know, the National Alliance for Recovery Residences, or NARR, sets the national standards for recovery residences. In this video, we'll cover the standards, core principles, and domains for recovery residences. And it's a part of the Recovery Residence Manager training. By 2015, the National Alliance for Recovery Residences, or NARR, established 20 state affiliates. In Texas, that state affiliate is the Texas Recovery-Oriented Housing Network, or TRON. TRON is a sister organization to Recovery People. The state affiliates are indicated in green on this graphic. You'll also notice that there are some emerging states. These are states that are interested in opening up a NARR affiliate in order to bring the national standard and certification program to that particular state. Altogether, by 2015, these state affiliates certified over 2,500 recovery residences, which means that about 25,000 people are sleeping in certified recovery beds each night. So the question is, why a national recovery residence standard? Ultimately, the answer is unification, education, and quality capacity. It was important for us to standardize a nomenclature, a language, in order to have a more productive and meaningful conversation, an apples to apples conversation, if you will. This is very important as we move across state lines because different state laws can really shape what organically grows within a particular region compared to another region. So if we wanted to have a meaningful conversation in California, comparing recovery housing residences to, say, those in Florida or New York or Texas, we needed to have this standardized language. It was also important to be very inclusive, create a big tent. NARR developed this philosophical framework, including the 4 general levels of support for different types of recovery residences found across the United States. This really helped with this whole issue of fragmentation. Historically, the recovery residence industry has been highly fragmented, and that means the knowledge base has been highly fragmented. So by having a common language, by bringing everyone together, we can have that common knowledge base and curate best practices. That's what NARR does. It reaches out to the grassroots level, collects best practices, brings them up and percolates them through the standards development process, and then from that then pushes them back out across the United States. It really offers a blueprint, and this is true whether you are a new recovery residence provider, somebody starting in the industry, or whether you've been doing it for decades. That's one of the things that we hear from recovery residence providers, even those that have been doing this for 10, 20, 30 years, is that in getting involved in the standards development, reading about the standards has really enabled them to identify areas that they may have never thought about and had identified areas that NARR hasn't thought about, and they were able to share that knowledge with them. In addition, researchers love the concept of standards because they've often wanted to study recovery residences, but without comparable subjects, they really weren't able to get the sample size studies that they were hoping for. Now they can. And also, it's a basis for a certification program, which begs the question, why do we need a recovery residence certification program? It's because more than just quantity, and Lord knows we need more recovery residences because there's just, we can't meet the market demand with the current supply. But we also need quality recovery residences, quality capacity. Certification offers this public-facing mechanism that empowers choice and instills confidence. And this is true whether it's an individual or family member trying to choose between one recovery residence over another, one level of support over another. But it's also true for funders. A growing number of third-party funders, whether that be insurance or different government agencies, are interested in paying for recovery residences because they generate better outcomes and, quite frankly, at a lower cost. But they struggle with knowing, so which providers do we fund versus which ones are the corrupt ones that are in the headlines. Also, referral agents. Most people moving into a recovery house or recovery residence were referred there by someone. And so referral agents need a mechanism to be able to identify those providers who are using best practices. Actually, we're seeing more and more state legislation that is linking referrals to NARR certification. Also, it provides consumers a protection plan, if you will, a grievance process. Every provider who gets certified under the NARR certification also agrees to have a grievance process. Grievances are handled internally unless they can't be handled internally, and then they can be floated up to the state affiliate. In NARR's experience, about 90% of the grievances are really resentments. There's not enough coffee in the house, or we've run out of sugar, but 10% of the time, the grievances are actually serious. And so Trone or another state affiliate can step in and kind of mediate the process between the provider and the resident and try to get the best outcome possible for both parties. Also, the certification incentivizes fidelity to best practices in a strength-based kind of a way. This is about sharing what works, what doesn't work, supporting each other, mentoring each other, and that looks very different than policing compliance through regulation. Something else to keep mindful of is that persons in recovery meet the civil rights definition of disabled. So regulating our housing more than anyone else's housing is actually discriminatory. So the certification process is a voluntary certification process, promotes quality without raising impediments, barriers to fair housing choice, and it complements existing regulation, not replacing it. So we'll learn more about fair housing rights in a later module within this Recovery Residence Manager training. And at the end of the day, certification is much more cost-effective and flexible than, say, regulation. So if you look in your course materials, you'll find the National Alliance for Recovery Residences standard. If you can't find them in your course material, you can always go to the NARR website, which is narronline.org. If you're looking at the standards, you'll notice that they're broken up into 4 different domains. In this graphic, you'll see the domains are in the purple boxes: administrative, recovery support, architecture, and good neighbor. Underneath the domains, there are 11 core principles. In this graphic, the core principles are in the white boxes that are framed in purple, outlined in purple. So for example, a core principle is going to be operate with integrity. And then across all these domains and core principles are 37 standards. Something to notice about how these core principles and domains are organized is look at under the domain recovery support. For those of you who are familiar with SAMHSA's definition of recovery, you'll recognize health, home, purpose, and community. That's what our federal government has identified as the supportive domains of recovery. What supports recovery? And recovery residences support all 4 domains. As we learn more about the social model of recovery, in later modules, you can reflect back on the standards and notice that a lot of these other core principles are really reflecting social model principles. So if you're looking at the standards, you'll notice that it's set up with a kind of dark colored row. That is the domain. So in this example, you'll see the administrative or operational domain. Underneath the domain is a lighter colored row, and that is the core principle. Underneath each core principle, you'll have 1 or more standards. So you'll see that the standards are numbered. Number 1 is recovery residences are guided by a mission and vision. Underneath each standard is examples of what can be objectively used to evidence that. Having an objective standard is very important, not only for the reviewer, but for the recovery provider themselves. So underneath each standard are a list of ways that a recovery residence provider may show that they do meet this particular standard. Something else to notice in the right-hand columns, you'll notice that there are 4 columns that are labeled with Roman numerals 1, 2, 3, or 4. And this refers to the different levels of support. So you'll notice in this here, let's see, standards 1 through 3 are relevant to all 4 levels of support. So they're required by all levels of support as indicated by the numbers, Roman numbers 1, 2, 3, and 4 listed to the right-hand side. That's different than standard 4 and 5. You'll notice that with standard 4 and 5, there's the circle R. What that indicates is that's recommended. It's not required, but it's recommended. Versus 3 and 4 are required for levels 3 and 4. So let's take a look at some of the other standards. Also under the administrative and operational domain is uphold resident rights. So all levels of support must communicate rights and requirements before agreements are signed, promote self and peer advocacy, and protect privacy. So I get most questions around number 8, protect privacy. What are the legal requirements? What are the ethical considerations for privacy and confidentiality? And we'll cover this topic later on in the Recovery Residence Manager training under the section called Rights. Also under administrative and operation domain are all recovery residences are recovery oriented. This is a core social model principle. All recovery residences view recovery as a person-driven, holistic, and lifelong process. Also, in recovery residences, we often talk about the culture. It's that secret sauce that we cultivate within our recovery residences. Also under administrative and operational domain, recovery residences are peer staffed and governed. So you'll notice that here, standards 12 through 15 apply to all 4 levels of support, whereas standards 16 and 17 only apply to level 3 and 4. So all recovery residences involve peers in governance in meaningful ways, use peer staff and resident leaders in meaningful ways, maintain resident and staff leadership based on recovery principles, and create and sustain an atmosphere of recovery support. This is essential social model philosophy principles that are listed here. Now, they look very different or they manifest differently across the different levels of support, but it's underlying philosophy across all recovery residences. 16 and 17 really are kind of pointing to the higher levels of support. Higher levels of support have more robust staffing models. They need a more trained and supervised staff because they're supporting higher needs populations. Moving into the next domain, the recovery support domain, here's promote health, one of SAMHSA's defined supportive domains. So the way that recovery residences promote health is encourage residents to own their own recovery, inform residents about community-based services, and offer informal recovery support services. And here we're really talking about the social model, and we'll have a whole module on social model so you can have a better understanding of what is it that we're talking about. As you move up into the higher levels of support, levels 3s and 4s, you'll notice that that's level 21 and 22 are required by both 3s and 4s. This is formalized recovery support services and formalized life skills development classes. And we'll also cover more about what are we talking about here by formalized. But essentially, it's a higher level of support. And of course, level 4s combine both the medical model and the social model. So level 4s, we see clinical services as well. Provide a home. All recovery residences provide a home. They provide a home-like environment rather than an institutional environment. All recovery residences provide alcohol and illicit drug-free environments as well. It's very important for people in recovery. And if it doesn't provide that, then it's not a recovery residence. It's something else. Are cultivated through structure and accountability. Those are 2 words that we've heard across the United States and across the different levels of support. This concept of structure and accountability as an essential element to recovery residences. Inspire purpose, meaningful daily activities. That can be volunteering, that can be work, that can be school, that can be being a caregiver. It's being of service. So something that's very important to recovery, something as recovery supportive, is to inspire purpose. And we see this across all recovery residences. And also cultivate community. We are living together as a family in recovery, creating a functionally equivalent family. It looks very much like a biological family. Now, this manifests in a different way across the levels of support, but it's an essential element in cultivating recovery residence culture. Foster ethical, peer-based, mutually supportive relationships between residents and staff, and also connect residents to the local recovery community. So it's not only about cultivating recovery and culture within the four walls, if you will, of the recovery residence, but it's also about connecting individual with the outside recovery community, and when appropriate, connecting that outside recovery community into the recovery residence. Now, architecturally, this is really fascinating. Architecturally, there are ways that we can promote recovery. We can create a home-like environment just with the architecture and design of a home. So when you walk into recovery residence, it oftentimes feels like a home because it's environmentally designed like a home. And also, does the architecture and design of the home promote recovery? Promote community and thus recovery. Promote health and safety. Recovery residences must meet health and safety standards just like any residential home meets health and safety standards. And also, recovery residences should have an emergency plan. Of course, levels 1s and 2s, that emergency plan is less sophisticated than a 3 and 4. But for best practices, all recovery residences should be thinking about policies and procedures that are an appropriate response to emergencies. And finally is the good neighbor domain. A big part of recovery is being and learning how to be a good citizen. That includes being a good neighbor. And so are recovery residences compatible with the neighborhood? Are they blending into the neighborhood and acting as a functionally equivalent family and neighbor? Are they responsive to neighbor complaints? So if a neighbor has an unrealistic complaint, that doesn't mean that the recovery residence has to comply with that. But you can't just ignore the neighbor. You need to be polite and engage them and have policies and procedures that are in place to appropriately handle neighbor complaints, as well as courtesy rules. So the number one barrier to recovery residences is what we call Nimbyism, not in my backyard. It's driven by unfounded fears and by stigma, but we can sure, poke the bear around that by being annoying neighbors. So having courtesy rules like parking rules, noise rules, smoking rules, cussing near the neighbor's kids rules, all these type of things can support us in recovery as well as being good neighbors. So that is the end of this presentation, kind of a short overview of the NARR standards. Know that if there's something in here that is missing that you want to contribute, the way that NARR works is that best practices and suggestions are funneled up through the standards committee. Periodically, the standards committee develops a new version, a draft version of the standards. It puts it out for public comment. Solicits input from you and from others across the United States. Once the standards committee develops a version that they want to present before the NARR board, it's presented, and then the NARR board votes on it. So there's plenty of opportunity for you to participate in cultivating the best practices. If there's something that NARR has overlooked, you can offer that up. If there's something that you think that is inappropriate or a barrier, you can provide that information to the NARR standards as well. The important thing is to get involved. To learn more, you can go to the NARR website, narronline.org. Thank you.